right, welcome. So, quick disclaimer, y'all. This episode is for information and educational purposes only. Nothing discussed here should be taken as medical or financial advice. Always consult with a licensed professional before making decisions about your health or your investments. All right, now we got out the way. Greetings. It is your host, Doug, the Organic One. And this right here is the jump off. We in here talking tech, walking transformations. Where we take what's happening in labs and link to what's going on right here in the community. This is information with global breakthroughs. And if you're tapped in, then you already know we moving real different over here. So here's what we're getting into today, a conversation that could literally save your life. We're talking about the future of medicine and the silent crisis still sweeping the nation. Let's get into it. Picture this. Your doctor walks in, instead of giving you generic pills, they hand you a treatment plan that's tailor-made for you, designed specifically for your DNA, your lifestyle with your surroundings. That's what we call precision medicine. This is cutting edge science. At the Boston Biotech Convention, they show how they can map your genome, basically your body's instructional manual, quick and affordably. And with that data, doctors can actually catch diseases before they show up, treat conditions with a custom game plan, and even step in before birth to prevent certain disorders in kids. This is not a one size fits all healthcare plan. This is tailored specifically to individual DNAs. This is world changing science. AI is discovering new medicine in days, reading scans and test results faster than hospital specialists, and catching diseases earlier and more accurately. But let's be clear, this is not replacing doctors. It's purely optimization. Faster results, better decisions, and less stress. Now let's talk about gene editing. That's a big one. There's this thing called CRISPR, CRISPR. It stands for clustered regulatory, no, it stands for clustered regularly interspaced short palindromic repeats. But in short, it's science edit it. In short, it allows scientists to edit your DNA, like cut, copy, and paste for genes. And it's already being used to treat sickle cell, cure inherited blindness, and decimate certain cancers like leukemia. And now with the next gen tools like base editing and prime editing, we're stepping deeper into the healing dimension. But while the future's looking bright, the present's got problems. We can't ignore STIs and surging. But while the future's looking bright, the present has problems. We can't ignore STIs and the surge that's sweeping the nation. Millions of new cases have emerged just last year: chlamydia, gonorrhea, and syphilis. And congenital syphilis, that's when you're born with it, that's up 10x in some places. Also, herpes 1 and 2, while not being deadly, they are on the rise globally, with the World Health Organization estimating over a billion people under the age of 50 with HSV1, and over 400 million live with HSV2. Now, here's the light. Real quick, I want to give a quick shout out to Out of the Closet here in Atlanta. It's a thrift store that doubles as a free STI testing spot. That's real community. That's real community care. Salute to y'all. But the crisis, but the health crisis isn't just about infections. Let's talk about the biggest weight on our people here in America, and that's chronic illnesses. We're talking heart disease, diabetes, cancer, autoimmune disorders. 6 out of 10 adults in the country got at least one chronic issue. 4 in 10 got two or more. And guess what? it hits us in the Black and brown community the hardest due to the lack of access, food deserts, medical bias. But here's the shift: we're now having wearable bio-tracking devices that give real-time updates and information on your DNA and what's going on and how you can prevent those chronic ailments from building up and accumulating over time and becoming the chronic ailments. So you can catch them in the prerequisite, or you can catch them in the stages before they become chronic. Look at that. We got wearable. We have wearable. We got wearables now. Bio-tracking devices giving real-time updates on your biofeedback. We got biomarker tech, catching diseases before it. We got biomarker tech. We got biomarker tech, catching diseases before it shows symptoms. We got treatments built off your own DNA data. This data is backed by custom fitted and next gen level healing. It's medicine on our terms. And if you've been watching, you know we got to talk about that money and where it's flowing. All right. So we got a lot of these companies that are public and definitely in the stock market. So they are planning to make some moves. We have Exact Scientists. We have Exact Sciences, Guardant Health, Recursion Pharma, C3.ai, Extensia, Therapeutics, CRISPR Therapeutics, Adidas Medicine, Beam Therapeutics, Intella Therapeutics, and Bluebird Bio. That's real-time biotech value coming from these companies. But here we have solutions. We face two battles. So where are we at with it? We face two. So where are we at with it? We face two battles. One with infections and the other one with chronic killers. But we also got tech to combat these crises. We got tools. We got a shot to change everything. If we demand equity, education, and access, there's no way this isn't a groundbreaking and world-changing breakthrough in the medical industry. But you know how that typically goes. But we have solutions that have been presented. Let's see what we do with them. And if this episode was insightful, share it. Text it to your people. Drop a comment. Follow for more. Stay locked in. Stay informed. This is America. And that's the jump off. I'm your host, Doug, the Organic One. Like, comment, subscribe to all love. Have a good one.